Hello friends, I am Dr. Jaydev Panchwagh. I am chairman of Synapse Brain and Spine Foundation and founding member of Neurochirurgische Hilfe Indien, which is Indo-German Neurosurgery Foundation. I have been practicing neurosurgery at Pune in India for the last 20 years and I am consultant neurosurgeon at Sahyadri Hospitals, Pune. Today I want to speak with you on a very common question asked by many patients and a lot of misconceptions around it. Simple question. People ask me, doctor, what is spondylosis? Now, spondylosis the word is uttered by the patients as if they have some great disease or something like that. And there are so many misconceptions around it. For example, people think that whenever they feel dizzy or they have vertigo, it is always because of spondylosis. This is one of the misconceptions. But let me tell you what spondylosis is. So spondylos in short means vertebra or bone of the vertebra, and osis means disease. That's all. Now, what is the meaning of spondylosis? So in short, spondylosis is like graying of hair. It happens with age. It is a process that everybody undergoes to different degree. As we all know, there are intervertebral discs in between two vertebral bodies. So one vertebral body, disc, other vertebra, this forms one unit or spinal unit. Now, what does the disc do? Disc is a cushion between two vertebrae. So when we walk, when we jump, when we play, these vertebral bones try to come together with jerks. These discs take up the jerks and cushion. Also, when we bend forward, the center of the disc, which is a jelly-like material, goes back. When we bend backwards, it comes in front. So this is not only a shock absorber, it is also ball bearing. So it is a very, very important structure in our spine. So as we age, the disc loses its turgosity because the water content goes on reducing. And as a result, the distance between the two vertebrae becomes less. The disc becomes degenerated, so to say. Now, whenever body senses that the relation between two bones in the body is undergoing some change, it is body's natural reaction to send calcium there to give stability. So body sends a lot of calcium and that area gets surrounded by deposition of layers of calcium. This is what is spondylosis. Along with that, as the alignment of the vertebra changes with the disc degeneration or decrease in the height of the disc, the joints between the two vertebrae, which are behind and on the sides, which are called as facet joints, they also become malaligned. So there also a lot of bone is getting deposited. The body is sending bone there to stabilize the perceived movement at that level. So a lot of calcium gets deposited, the vertebral column becomes stiffer, the pain starts, and this is a process which happens in everyone as we age. In some people, this process of spondylosis becomes too much, that is, it goes out of hand, and that calcium which is deposited starts pressing on the nerves and pressing on the spinal cord. And then it becomes a problem because then the spinal cord gets compressed, the muscles below that level of compressions get weak, and neurological symptoms start, or one can get sciatica, one can get pain in the shoulder and which is traveling along the arms. So these neurological symptoms start in only some people who have spondylosis. So Let me summarize. Spondylosis is not a disease. Spondylosis is a process of aging of the vertebral column. If in your case, genetically, your spinal canal is either narrow or your spondylosis process is becoming too much because of genetics, then you may have problem. So remember again, spondylosis is not a disease. It is an aging process, and with regular exercise, it can be delayed to certain extent. But if it gets converted into neurological symptoms or compression of the spinal cord, then you have to act and get treated for that. Thank you very much. I am Dr. Jaydev Panchwagh, and if you have any questions, do write to us. We'll certainly answer them. Thank you very much.